And we're back on Consumer Choice Radio. I have the pleasure of introducing one of our guests for today's program. He was the youngest MP elected in the Greater Toronto Area. He's the Member of Parliament for the riding of Beaches East York. And in a world of very rigid party politics, is one of the most independent members of Parliament in the country. Welcome to the show, Nathaniel Erskine-Smith.
Yeah, thanks for having me.
Great. So right off the top, I mean, obviously, everybody's job has been affected by the pandemic. A lot of us are working from home. What's it like to try and do Ottawa virtually? What is virtual Parliament like?
It was a challenge early on, but I would say that we've settled into a pretty decent routine where the House of Commons has established virtual committees, virtual parliament. We can do it through Zoom. We can vote. Right now, we're working on a voting app with facial recognition so that our votes don't take over an hour. So really, the House of Commons administration and staff have stepped up and made it happen in a serious way. For me, I've got a 4-year-old and a 1-year-old, so I have appreciated the time. It's been a challenge at times to balance both, given you're working from home oftentimes, but I get to see my kids a lot more. And my life previously was back and forth between Toronto and Ottawa every other week. So it's in some ways, my kids know me and like me a lot better.
Yeah, that's good. If I remember correctly, you were reading your it was your son or your daughter a bedtime story and voting, I
Yeah.
believe.
Yeah,
That
it was
was
the first virtual vote, and I didn't fully appreciate that the camera would linger on me after I'd voted. And so I voted and then immediately went back to reading my 4-year-old son, Mac, Shel Silverstein book and poem. And anyway, it became much more of a thing than I ever expected. And, and I think Mac at one point, I guess after I'd gone back or after I was voting, he went, no, and like yelled louder than I had yelled. So there's the challenge of I now manage beyond bedtime to vote to make sure that doesn't happen on the regular, but it was a unique moment of virtual parliament.
And in terms of the issues that you guys have been able to vote on or to have committees on, is there something that has been brought up in the deliberations that would be much easier to do in person that has been really hard to do sort of virtually? I know there's a lot of talk about the different regulations and any kind of economic packages and restrictions on travel. Is there any of that that's just made all the more difficult, or do you think everything has been pretty efficient so far?
Early on, it was a challenge because before we had virtual parliament set up, we couldn't they reduced quorum numbers and many of us couldn't be in the chamber to vote. And so that was obviously a real challenge. I would say the greater challenge is not so much the virtual setting, but just the emergency setting. So needing to deliver these programs very quickly. And so having the time for debate that we ordinarily would have, there just isn't that time. And so that's been probably the greatest challenge, where we see a program like the wage subsidy, for example, is now being abused by companies who really are undeserving of it and are abusing our goodwill. That wouldn't have happened probably if we had rolled that out over a 6-month to a year time period, had sufficient debate in both chambers, but we were rolling this out really quickly to get support for businesses and individuals in need. So I think that's been the greatest challenge. The one thing I would flag in terms of the virtual limitations, just there's a lot that gets done informally in caucus, sitting next to colleagues, in the chamber, sitting next to colleagues, in the lobby, sitting next to colleagues, and having those informal chats and building up coalitions of support for different issues. And that is a lot. We have to be much more explicit and direct in our text messages, emails, phone calls to build that kind of support and to communicate with colleagues now.
Yeah, it's almost like missing the water cooler time.
Yes, exactly.
For your average office worker. Switching gears here to something that you're passionate about, and a topic that Yael and I are both quite passionate about, is harm reduction. So you've taken what many people would probably see as a pretty bold stance, and said that when it comes to substance abuse, that is a health issue and not a criminal issue. And if I remember correctly, you've recently put forward some bills that would approach the issue of substance abuse from a harm reduction perspective. Can you walk our listeners through what it is that grounds that opinion and what the end goal is of going the direction of decriminalizing things like drug possession and whatnot?
Right. So first, I think we need to know the backdrop, at least here in Canada, that since January 2016, over 16,000 Canadians have died because of the opioid crisis. And pre-pandemic, StatsCan had said that our life expectancy has stalled for the first time in 40 years, and they pointed to the opioid crisis. Now, our public health experts have said we should treat drug use as a health issue, and there's great stigma to people seeking treatment. And what is that stigma? Well, there's societal stigma and the moralizing around drugs, but there's also the criminal sanction. And the largest stigma that stands between someone who needs help and the help that they need is the criminal sanction. And this is not about traffickers and producers. This is about the very people who need our help, people that we would treat as patients in other contexts. We would treat them if they had a gambling addiction, if they had an eating disorder, if they had an alcohol addiction. We would be treating them very differently, and we would not be threatening them with criminal sanctions. And we need to do the very same thing when it comes to substance use problems. And that, it's as simple as that. Now, I would say it's not particularly bold insofar as public health experts have called for it for many years. Police chiefs recently here in Canada, our National Association of Chiefs of Police, have called for decriminalization and said our current drug laws aren't working. And in no other context do we see such a scale of harm and see the laws that are in place are actually exacerbating and perpetuating that harm.
I have one question I think is relevant for a lot of the debates that are happening in the House of Commons, but also happening in the different provincial capitals. How do you see the evolution of sort of federalism in Canada throughout the course of the pandemic? Is this something that do you think has helped some areas kind of weather the pandemic? Has it made things more difficult? I know you're obviously in sort of the federal parliament, so you're dealing with a lot of those issues. But I'm wondering your view of sort of federalism of the jurisdictions of the provincial legislatures. If you see a tug of war there, are things getting better? Are they getting worse? Obviously, I'm from Quebec, so I'm very biased. But yeah, I just want to know your thoughts.
Our federal structure is really important in some ways as a matter of checks and balances, and obviously provincial jurisdictions, and then ultimately through municipal jurisdictions in some cases, these jurisdictions are on the ground and better placed to serve communities with specific and different needs than the federal government in many contexts. I will say there are challenges in the course of the pandemic where we see some provinces that maybe didn't act quickly enough to protect long-term care homes. We see provinces that didn't act quickly enough to establish paid sick leave and or didn't at all, and really didn't step in, take commercial rent subsidies as an example. The federal government has stepped in and in a serious way and supported an area really of provincial jurisdiction. So I think areas of jurisdiction have in some ways impeded our pandemic response. And in other ways, I think just from a citizen perspective and the messages I get in my inbox, they have fallen away in many respects, that there's a demand from Canadians to say, that's not good enough. I want our seniors protected in long-term care homes. I don't give a damn if it's provincial responsibility. You both have to work together to make this happen. Our social safety net is broken. Millions of people would have been left behind if the federal government hadn't stepped up with CERB. So fix this, work together and fix this. And so I think there's going to be a real push, whether it is childcare, housing, or long-term care, and any number of issues, that there's an expectation from Canadians that all levels of government need to work together. They have to stop pointing the finger at each other and say, we've done our part, it's now up to them. We need to work together to deliver for Canadians. And the pandemic will have, I think, really put pressure on us as governments to work together and to get things done.
And on that relationship, that federal provincial jockeying, so have there been open ears when it comes to harm reduction at the provincial level? Because it's one of those weird scenarios where the federal government can certainly change laws, but in many instances, the facilities and programs that people would be entering into are at the provincial level. And I know there's been some irritation with the Albertan premier over his viewpoint of whether or not the province should adopt certain harm reduction principles. And so I'm interested to see what your take is in terms of how this progresses. So let's say your bill moves forward, it gets passed, we are able to make these tweaks to the criminal code. What's next for the provinces then to really make sure that we are preventing overdoses and helping people get ultimately the help that they need?
Right. So we've seen this debate, unfortunately, play out to some extent already as it relates to safe consumption sites. And it used to be the federal government was opposed to under the Harper years. change of heart on the, the Supreme Court was very clear unanimously that safe consumption sites save lives and their benefits have been proven. We've expanded their use significantly, but there has been, obviously, there have been pressure points, certainly with Alberta, as you indicate. There are other provinces that are very much on board with an evidence-based drug policy focus and a harm reduction focus. I think we are going to have to, when we look at ramping up supports, this isn't only about removing stigma. This is also about then increasing treatment and supports for individuals in need. So that is ultimately going to come down to, yes, federal dollars in some cases, but ultimately come down to delivery through the provinces. We should put conditions on some of our dollars to say we will fund treatment, but it has to be evidence-based. So for example, abstinence-based treatment should not be on the table for federal funding. But it's going to require the provinces to step up in a more serious way. Some provinces won't step up in the way that I personally want, I don't think. So we have to work with like-minded provinces where they exist, establish best practices, show the evidence and what works, and then I fully expect other provinces along the way to add their voices and to come on board. And I think it will get much easier now that the police chiefs are on board as of July. I think it will be much easier. I've seen the debate already in Parliament with my own bill. It's the language of conservatives has shifted significantly on this issue in a very short period of time.
And on that note, real quick, in terms of working with the conservatives, do you see a lot of movement, sort of an opening up on that issue broader? I mean, are you able to get a good number of members that are listening to you and want to hear about your bill, or is this something that's still kind of partisan? I know there have been a lot of reports about the leader, Aaron O'Toole, and sort of his views on it. Is this something that is becoming a bit more sort of uniting of the parties there in Ottawa?
I think the conservative position has softened significantly. Aaron O'Toole's comments were welcome in large measure when he said serious penalties shouldn't apply to people who have substance use issues and are possessing drugs for simple possession. Of course, no penalties should apply. So there's still some room for Aaron to move there. I would also say we've had 1 hour debate on my bill. We'll have another in early March before it heads to a vote as second reading. The real goal of that bill for me is to elevate the conversation, send it to committee, bring expert witnesses, police chiefs, public health experts, prosecutors. We've had judges that have been public in their comments on this, and really elevate those voices to say we need to change our laws and the government should do it, not a simple, not a private member as far as it goes, but my job is to further the conversation. I think conservatives will continue to shift their rhetoric and to change their minds. And part of the reason for that is we see different voices come on board. I mentioned the police chiefs. The other reason for that is every community is affected. People are dying. I mentioned thousands of people, and they're dying from all socioeconomic backgrounds and all political stripes. So this is affecting all of our communities.
And when we look at what a harm reduction model could look like, I think we're, as of just a few days ago, Oregon has officially shifted its approach, and a lot of people point to Portugal. I'd love it for you to weigh in as to maybe what has worked or what hasn't worked abroad, because I know Yael and I talk about bold policy ideas all the time, and a lot of times ordinary Canadians go, well, okay, has anybody already done this? Does it work? Do we have evidence to support it that it works? And so I'd love to hear your take on some of the background knowledge of whether it's worked abroad.
Right. So many jurisdictions have moved forward closer towards decriminalization. Portugal is probably the example that most people are aware of in this space. And there, the evidence is very clear. In 2000, when they moved forward to this approach, they didn't say it is no intervention at all. They basically said if you are caught with the possession of a substance, a controlled substance for personal use, you would go before a dissuasion commission. So instead of a judge in a criminal context, you would go before a social worker, a health professional, and a legal professional, and they would take a public health focused approach with your interests in mind. And we see there that the number of overdoses went down. We see that the number of people seeking treatment increased by 60%, which is the most important number. Obviously, incarceration costs and everything else went down too. And the number of people using drugs didn't increase in any noticeable or demonstrable way. And problematic substance use among young people actually declined. So all sorts of good numbers coming out of Portugal. The real question, and I think where the debate ought to be, is what kind of intervention is required, if any, as an alternative to incarceration. And so conservatives in the debate we had put on the table where there should be mandatory treatment. Well, we know actually on the evidence we have that mandatory treatment doesn't work. So is there a role for an intervention, or is there a role for education as the intervention? So do we want the law to impose itself in any way, the way Portugal does? Maybe we do, maybe we don't. Or is there more of an education focus and a referral to healthcare providers, but not on an obligatory, mandatory basis? And so I think if that's where we center the debate, I think it's a very helpful space for us.
Fantastic. Well, we'll certainly be following up with you after this, and I hope that this continues to move forward, and I hope we shift the Overton window on having this policy discussion. So thank you for your work on this, and thank you for joining us on Consumer Choice Radio.
Yeah, thanks for having me. I really appreciate it.
Great.
Thank you.